Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Good evening, beloved viewers. Welcome to your week's favorite health talk show, the DocTalk Show, where we mind about your health because your health is your wealth. And we made a promise that we shall go out all year round so that every week we come to you with information that is going to empower you and your family and friends. It's your host, Dr. Gavin Nyanzi, and we are here this evening to discuss something very important, very common in our homes and schools and entire community, and I believe you're going to like it. So at this juncture, I would invite you to remind your family and friends to tune in. We are live on our social media handles, that is Facebook, DocTalk Show, as well as on YouTube. Invite your friends and share that link. And special recognition of our sponsors, the National Medical Stores. They make it a point that this show comes to you every other week, as well as Camelin Men's Collection, you with your brothers or husbands or friends. That's the place to go in 2022 if you're going to look very, very smart for that job interview, for that introduction, or for your wedding. That's the place to go. Located on Zebra Plaza, up on Kampala Road at the intersection with Entebbe Road. In studio with me this evening is a specialist, a pediatrician, and called Dr. Judith Lubega. She works with the Kawempe National Referral Hospital, and she's here to discuss or to enlighten us about pneumonia in children. I don't know what you call it, but it's something that's probably been to a clinic or to a hospital and your baby or your child has been diagnosed with pneumonia. Dr. Judith is here to give us more information about this. Dr. Judith, you're welcome.
Thank you very much, Dr. Nyanzi. Thank you for having me here. Thanks to the Doc Show for having me. For our viewers, good evening, and hope you enjoy the ride.
Wow. Yeah. Thank you, Dr. Judith. So, pneumonia. I've interacted with friends, with people in the public, and I usually hear people talk about, my daughter has pneumonia, my son has pneumonia. Yeah. Dr. Judith, the viewers want to know exactly what is pneumonia. Is it what is pneumonia in children?
Yes, actually, it's very timely that you actually asked me this. There has been I'll call it an epidemic of pneumonias moving around the country recently. So what the parents would want to know is just something that would relate to them, is that pneumonia is a disease condition that presents itself basically with, I would say, cough and fast breathing.
Okay.
Yeah, when you see cough, fast breathing, and fever, then we'd say that you have a pneumonia.
A pneumonia.
Yes.
Okay.
Yeah.
Is it something that is very common? Is it a big problem in our setting or globally? Is it something that is really a big challenge with us that people should be concerned and actually know about it?
Yeah. I would actually say that it's a challenge globally. Globally, you find that in the diseases that we have in children, pneumonia caters for 16%. 16%. Yeah,
wow.
whopping 16%. And majority of those children who suffer from pneumonia, of this 16%, majority are from South Asia and actually Africa.
Okay.
In Uganda, it's the third cause of mortality amongst children under 5.
Wow.
Yes.
Third cause of mortality.
Yes.
So it's a big problem.
It's a big
problem.
Many
children die from pneumonia.
We're looking at 25 children per day who die of pneumonia in Uganda. So you're looking at 2 taxis every day.
Oh my God.
Yeah. So it's also a Ministry of Health concern. It should be a community concern, and it's a pediatrician's concern. So that's why we're discussing it today. Yes.
Okay. Dr. Judith, you've said the main features in the definition. It's basically cough and fast breathing. Where fast breathing would be like how many breaths per minute?
Yeah, so with fast breathing, if the child is between 2 months and 1 year, you'd look at 50 breaths per minute.
Okay.
And if the child is from 1 year to 5 years, you look at 60 breaths per minute.
But I know, of course, a parent
That
will be
would
able
be-
to see that the breathing is abnormal.
Yes,
It's not the
yes,
normal breathing.
Yes.
So beside that, usually these are basically the main features when you're
Yeah.
looking at pneumonia.
Yeah.
Okay.
Yes.
25 kids dying every day.
Yes.
That there is something that, will cause pin drop silence in a room. That's quite a big number.
Yes.
Making it number 3 leading cause of death in children under 5.
5 in Uganda. Yes.
How come it must be common? What are the, should I say, risk factors? Are there people that what exposes children to this monster pneumonia?
Yes. So some of the risk factors that are common that we're going to discuss, we look at children who are not breastfed exclusively for the first 6 months.
Okay.
Maybe mothers who skip, maybe because they are working and they can't breastfeed their children. Those ones are at risk of pneumonia. Those children who are malnourished, who are not well fed, according to the standard way of feeding children. Some children who have chronic diseases like HIV, and then also environmental exposures. For example, poor hygiene, poor sanitation, and those are some of the things we're going to discuss how to prevent. Actually, washing your hands routinely can actually take a long stride in preventing pneumonia.
Wow.
Yes, in children under 5.
Before I get to that, which I'm going to get to.
Yes.
So you bring out a very important point, because I've hosted a number of different specialists discussing children and sometimes maternal health.
Yes.
And the element of exclusive breastfeeding for 6 months is very, very, very important. And I'm very surprised you bring it up here.
Yes.
So to the mothers watching us there, even fathers, you have a sister, you have a wife, let us try to create an environment where our new mothers can have the opportunity of breastfeeding their children exclusively for the first 6 months. Even the employers, creating opportunity for mothers, to be able to breastfeed their children, because it's one of the measures in which we can fight the pneumonias. Yes, we're talking about the washing of hands, how it has helped to.
Yes, one of the single-handed public health interventions for prevention of pneumonia, which is community-friendly and consumer-friendly, is hygiene, washing our hands. I know, being part of Uganda and Africa, one of our greatest dilemmas are infections in the dust we have, in the roads we have. And we're saying we're not just going to sit back, but to encourage mothers to always be clean before giving the child any meal and after to wash hands. And funny enough, children under 5, like 2 years above, can be trained how to wash and
hands.
keep clean as well.
Wow.
Yes.
That's amazing. Do you, probably or I've not followed it, but now that you've mentioned it, is there a possibility that actually this could have come down during the COVID time because there was hand washing as a practice all through? Is it something?
That's like a very perfect notion. Because actually different studies even done before, there's a study done in 2015 that talked about fading immunity, waxing immunity. So the fact that children were at home and not really going to schools and not exposed, and they're in a cleaner environment, they were the prevalence of these pneumonias had actually gone down. Yeah.
Wow. Dr. Judith, you're going to hold it there. We're going to take a break and we'll be coming back in a moment. Special thanks to National Medical Stores, our sponsors for the show, as well as Camelin Men's Collection. Please remember to share this link, our link, DocTalk Show on Facebook, as well as on YouTube. Share with your friends. Let everyone get to tag into this very important show tonight. Thank you. We'll be back in a minute.
You are watching the DocTalk Show.
A good school doesn't tolerate violence against children.
Because a good school equals a better life.
Raising voices.
Water gives life. Water is life. But not all water is created equal. Refresh yourself with the new quality Nirvana packaged drinking water and fuel you and your passion to go further in life.
Visit a shop near you and grab a 250 ml at 500 shillings, 500 ml at 1,000 shillings, 1.5 liters at 2,000 shillings, or the 20-liter jumbo bottle. Nirvana is a product of Crown Beverages Limited, the makers of Pepsi products.
You are watching the DocTalk Show.
Thank you for keeping it here with us. For you that has just joined in right now, this evening we are discussing something very important, and that is pneumonia. And in studio with me tonight is a pediatrician. These are doctors that have specialized in taking care of children. Dr. Judith Lubega, working with Kawempe National Referral Hospital. Special thanks to National Medical Stores and Camelin Men's Collection for bringing this show to us every week. Before we took a break, Dr. Judith, you were talking about risk factors which children are exposed to this monster of pneumonia. Please pick it up from there.
Yes, so one thing I just want to highlight is that some parents actually during this last wave were beginning to think that they have to keep their children from going to school, from going to home, because overcrowding sometimes is one of the risk factors. But I just wanted to clarify that if we keep to the standard SOPs of hygiene, of washing hands, that should not be a worry. I'm not saying that should be a worry. I just want to clarify that yes, overcrowding is a risk factor for pneumonia, but if we wash our hands and train the children to see, remember, children are people who do what they see.
Yeah.
Yes. So so the teachers at school, the parents at home, even Sunday schools or other places of worship where children are gathered, they should the adults should try to practice what they want the children to also practice. That would help us.
Yeah, I remember during the COVID, I could when they had eased and you were able to travel around.
Yes.
I visited a number of homes, and actually there were jerry cans at the gate or at the veranda, and everybody in the home was continuing to practice the washing of hands. But the story is slowly changing. So I think this point emphasizes to our viewers this evening, let's not get tired of washing hands with soap. It has very far-reaching impact, even just beyond the COVID, like we've just seen in pneumonia. And the children will do what they see the adults do. So if we continue this practice, probably will contribute to the numbers decreasing from 25 kids dying every day in Uganda because of pneumonia. Dr. Lubega, would love to know what exactly, maybe somebody's wondering, yes, cough and fast breathing, what exactly causes this pneumonia? Where is the problem?
And like you actually had asked me earlier. Of course, you'd have cough, fast breathing, and fever. But to make it the parents understand better, we look at cough and fast breathing, because fever can cause a myriad of things. Yes. So causes of pneumonia, we have viral causes, bacterial causes, and fungal causes.
So that means there are different number of organisms that cause disease. And you've said it can be bacterial. You've had some of the organisms are called bacteria. There's also what we call virus and what we call fungal. Yes, Dr. Judith, continue with that.
Yes. So one of the common viral causes of pneumonia, most recent, is COVID. Yes. And most parents are like, oh my goodness, is this COVID? Is this COVID? But the Ministry of Health, in conjunction with Ministry of Education, recently released a quick surveillance study that they did and found that this last wave was due to influenza A, which is actually a virus.
A virus. Wow. Yes. Not COVID. Not
the virus due to SARS-CoV-2, due to COVID.
Oh yeah.
Yes. And then bacterial causes. Commonly we have pneumococcal causes, and then that's why we have the pneumococcal vaccine,
Wow.
which we'll talk later about. So
Okay.
that's a cause. For the fungal causes, it's usually amongst the immunosuppressed children, so we may not need to dwell so much on that.
Oh, so
Yes.
immunosuppressed, that's like somebody who has HIV,
HIV,
or
maybe
cancer that
cancer.
suppress the immunity.
Yes.
That's why we can have fungal causes.
Yes, commonly that's where we can have fungal causes. Children with diabetes mellitus,
Okay.
yeah, type 1, they can be at risk of fungal causes of pneumonia.
Okay.
Yes.
Beside the cough and the fast breathing that is caused by these organisms, are there other features that a parent should be looking out for in their child, that when this happens, then I should be very, very, very observant and be able to seek medical help as soon as possible?
Thank you, Dr. Nyanzi, for asking me that. It's something that I actually want to dwell on for the mothers, because it helps. One thing about pneumonia is that when the danger signs are picked out faster, and then the parents bring the children to the hospital faster, we're able to reduce that mortality of 2 taxis.
Able to prevent more deaths.
More deaths, those deaths of 2 taxis. So we look at general danger signs. So mom and dad at home, if you see a child who has refused to eat, that's a big sign for children.
Wow.
If you see a child because children would not want to refuse to eat.
They should be able to eat
They
normally.
should be able to eat normally. The foods they like, the gorillas, chips, like even they are nice foods. And then if the child is vomiting, a child who is vomiting, the moms and the dads know you can't get them to put anything else inside. And then a child who I would say is unconscious, because parents have seen this and brought unconscious children. And then the 2 danger signs that are specific to pneumonia is, I'll call it noisy breathing.
Oh, where you're able breathing in, but every time the child is breathing in, you're hearing some noise in the chest.
Yes, noisy breathing, what they call it ukuzira.
Okay.
Or we can call it wheezing or stridor, because some parents may be able to identify wheezing or stridor. And then the second is chest indrawing, which is the fast breathing you talked to me about.
Where they breathe in and the muscles of around the ribs in the chest are going in.
Exactly.
Okay.
And you're actually pointing to the right point. You're pointing to the right point. It's the lower chest. When you see this lower chest entering inside, parents, deep inside, that's what we call lower chest indrawing, and it's actually a danger sign. Do not wait. Do not call anybody on phone. Just rush the child to the hospital.
To the hospital.
Yes.
Wow. This is very, very revealing.
Yes.
And of course, for the little ones below 2 years who are still breastfeeding,
yes,
you're trying to give the breast milk, but they seem not to be interested.
Yes, yes.
Okay.
Yeah, in fact, that question you asked me is very good.
Okay.
Because most people tend to. That's the good thing about also going to see a pediatrician. The younger, the more fragile the child is. Because if you look at these breastfeeding children, it's just about the breast milk. And sometimes when mothers see that the child is not breastfeeding, they may want to change and give the children feeds that are not yet appropriate for age, but just bring him to the hospital and have the child reviewed, especially if this child had cough that has now come into fast breathing and even has expounded to be having a fever.
Wow. You've mentioned something very important.
Yes.
Sometimes, actually, when the child is unwell, they will try to stop breastfeeding and the mother will think maybe the child is fed up of breast milk.
Yes.
So instead of making the decision of switching your baby to something else beside breast milk, please run to a hospital, run to a medical center and seek medical help. So when the kids come with one or all of those signs,
yes,
when you respond, there's usually hope. They're able to be helped out of the situation.
Yes. First of all, I want to tell, I know, is it okay to always say mothers?
Yeah, that's fine.
They say I'm being gender insensitive.
Mothers,
so mothers, fathers, and judges, caretakers.
Caretakers,
yes. Well, pneumonia is a treatable disease.
Wow.
It has a cure. Well, of course, depending on the cause, but basically we can manage it. Most of the hospital settings should be able to manage it. how are we going to manage this pneumonia?
Okay.
First of all, it depends on the cause.
Wow.
If it's a bacterial cause, we're going to give you antibiotics.
Prescribed by the doctor.
Prescribed by the doctor.
Known to the mother themselves. You don't
Mother
run
is
to the
not-
shop, to the drug shop to buy an antibiotic. Hey, it has to be prescribed
By
by
the-
the doctor, okay?
And thank you for that, Dr. Nyanzi, because self-prescription is bad. And during this wave, we've been having issues of polypharmacy. Polypharmacy is when you find a child having more than three drugs
taking them
and
at the same time.
I know mothers with children, it's hard for us to get the right dosaging and everything, but we try to keep it under 3 syrups if we have to send you back home. And it's also not that when the child has pneumonia and you come to the hospital that we are going to admit. We only admit if it's severe pneumonia.
Wow.
Yes, but if it's pneumonia as it is and it's not severe, you can actually go back home with the syrup. And in Uganda, we start with amoxicillin syrup.
Thank you,
Yes.
Dr. Lubega. You're going to pause right there. We're
Okay.
going to pick it up from there after we are back from the short break. Please share the link, DocTalk Show, on Facebook and YouTube. And if you have any questions, leave them in the comment section below and we will actually get back to you promptly. Special thanks. I can never get tired of mentioning our sponsors, the National Medical Stores, as well as Camelin Men's Collection. We will be back in a minute.
You are watching the DocTalk Show.
It's Powerful Level Magazine with your girl Mary. Tonight on the show we have the Johnny Walker and Barra Tour. We have Lillian and the Sundowners at Smack League. We have Spice Diana EP released for you on the show. Don't miss Powerful Level tonight at 11 p.m. and catch the repeat on Saturday at 12 midday. Enjoy Powerful Level Magazine as you prepare for the Martyrs' Day tomorrow that we shall be airing live on UBC. Keep watching UBC. Bye-bye.
Uganda has a budding film industry that will be celebrated at the Uganda Film Festival 2022. There'll be workshops, film screenings, and a world-class gala. Vote for your viewer's choice movie through the online voting platform that will be part of the drive as we use the creative sector as a solution to unemployment. The Uganda Film Festival is powered by the Uganda Communications Commission.
You are watching the DocTalk Show.
Thank you for keeping it here with us. We don't take it for granted. Kindly share the link with your friends in your neighborhood. If you have a screen, invite your neighbors to come and join you so that they can share in this very important information. In studio with me tonight is Dr. Judith Lubega, a pediatrician working with the Kawempe National Referral Hospital, and we are discussing pneumonia. And very important that I've picked out of this, we basically have 2 symptoms we look out for in our children. Cough, and when you think your child is breathing faster than normal. Once you see those 2 things, run to hospital. Run to hospital, run to the medical center near you, and your child will receive attention because she has told us, can you imagine? This is the 3rd leading cause of death in children under 5. 25 children, 2 taxis, kamunye, of babies or children die every day in Uganda because of this preventable disease. So, Dr. Lubega, I know before we broke off, you were giving us hope that way this is manageable, and when a parent or a caretaker brings a child to hospital, they can manage them. Please, let's continue from there.
Yes. So like I was telling you before we went out for the break, is that if the child is not having any severe forms of pneumonia, we'd actually want this child to go back home with the parents. We don't really have to keep them at hospital. However, if there are the danger signs we talked about, the child cannot feed, the child is vomiting, this child will have to stay with us at the hospital. And usually averaged it's for 2 to 3 days.
Okay.
And basically what do you expect? because pneumonia is associated with our lungs, it may cause reduced levels of oxygen in the blood. So we may need to give this child oxygen. It's not something that should worry or make you fret. It's just something that will be associated because the lungs are the ones that are being affected. So I want to also calm the parents and not think that because they're going to get oxygen, maybe they're going to lose the child or something like that.
Wow, that's a very important message you've passed on there, which actually I missed in the beginning. It's a disease of the lungs.
Yes.
So usually for the three causes, whether bacterial or viral or fungal, it's basically affecting the lungs.
Yes.
And that can have a negative effect on the oxygen. So sometimes when they put your child on oxygen, it's not meaning that the child is going to pass away, but you're trying to support to increase the oxygen that has been reduced. Yes, Dr. Lubega.
Yes. So they put the child on oxygen, and once the child starts breathing well, the child is no longer having that depression in the lower part of the chest. The child will be taken off oxygen slowly but surely and safely, and then this child will be able to be let home. But also to point out is that in case any of these cases get any severe, there are certain other investigations that may be requested, of course, with the parents' consent. Something that parents tend to fear, like a chest x-ray.
Okay.
But the benefit is much more than the risk. And for any chest x-ray to be dangerous to the child, would have to do more than 10 per year. Per year, 10 per year. Yeah, so this is just going to be one chest x-ray.
In this particular illness.
In this particular illness. And then we also have blood cultures. All this, your doctor will be aware and will be doing these things just in case your child is not getting better.
Okay.
Yes, within the 2 to 3 days.
Okay.
But also for certain peculiar instances whereby you find the child is having this cough and fast breathing and it's going past 14 days, that's like 2 weeks. There could be other causes as well.
Okay.
Such as TB.
So if it goes beyond a week, you said a week?
Yes.
So you begin thinking about something away from pneumonia.
Yeah.
And that's why you will have to do some other investigations.
Yes.
Okay. And you said it could be?
Yes. If it goes past the common 3 days, we'll go past the common causes of the pneumonia.
Usually in 3 days, if it was pneumonia, in 3 days of treatment, the baby is better, the cough is reducing, the fast breathing is coming down. So usually if it goes longer than that, we'll begin thinking of other lung infections.
Exactly.
Okay.
We'll be thinking about other causes of pneumonia, because TB is also a form of pneumonia.
Okay.
But we're just looking at the common causes of pneumonia, because remember during this wave many parents were worried. They're thinking about, is it COVID, is it TB, is it anything like that? But we also want to ask parents and the community to also give the health system time, so that we don't always have to keep pumping the children with unnecessary drugs. Because once this child is calm on oxygen, is getting maybe intravenous form of feeding, or the feeding is now controlled, you can now give the system enough time to exactly find out what this is.
Okay.
Because it could be pertussis, one of the 6 killer diseases. It could be so many things. But there's also what is always the common thing.
Okay.
Yes. Yeah.
Wow. So there is hope, and it's a joint effort.
Yes.
The clinicians, the community, where we have the parents and the caretakers, you know, because Dr. Lubega has mentioned that the earlier we seek medical help, the more chances of this baby or child surviving. So there is hope. Pneumonia is treatable, in spite of the fact that it's a big monster, taking away 25 of our children every day in Uganda. It is preventable. So we have to rise up and let's share this information. And in case you saw your neighbor and probably they're having issues, instead of the neighbor running to a drug shop to buy something to self-medicate, let's go and seek the proper care. Yes, Dr. Lubega.
Yes.
Are there things that we can do in the community that can help us to prevent? Because the English say prevention is better than cure, and that's the language actually our president, the president of Uganda, usually preaches. Prevention is better than cure. Prevention is better than cure. Is there anything that strategies we have for preventing this disease?
Yes, thank you, Dr. Nyanzi, for asking that very key question. Actually, globally, there is an action plan for prevention of pneumonia.
Okay.
And I'm going to go back to emphasize exclusive breastfeeding.
Wow.
And then I'll also talk about complementary breastfeeding, because most mothers say, should I stop at 6 months? Breast milk has so many antibodies and protective factors that if you could breastfeed this child on top of other feeds that they're supposed to get for at least 2 years, your child will have less frequency of these pneumonias.
Wow.
So breastfeeding and adequate breastfeeding is very key in preventing these pneumonias. Hygiene, hand washing, good nutritional status of these children, an apple a day or a fruit a day.
Keeps the doctor away.
A mango a day, a fruit a day. It seems cliche, but it really will go a long way. And then I don't want to exclude the vaccination, the pneumococcal vaccine that helps prevent against strep pneumonia, bacterial causes of pneumonia.
Is that vaccine part of the vaccine under Ministry of Health?
It is.
Wow. Okay. And so we should take our children for vaccination.
Yes, you'd expect this child to get that vaccine at 6, 10, and 14 weeks. Okay. So parents, we still make that call that you actually take the children for this vaccination. It's just a small shot on the right upper thigh, and that can also prevent on the frequency of these pneumonias. Yeah.
Wow. And so we realize that actually prevention is not much rocket science.
That's the beauty about it.
The investment in the prevention is way much cheaper than what we would spend when our children get these illnesses. Yes. And for me, what is key, 2 things that are key, she has talked about hygiene. Let's not, now that COVID seems to be at bay, let's not stop the hand washing. Yes. Let's practice it. Let's practice it in our homes, at church, in our offices. Let's continue the practicing of the hand washing. And then also very importantly, breastfeeding. You've heard time and again here on this show the importance of breastfeeding our children. There are many, 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 many advantages or benefits that a child gets from breastfeeding. I know many of our mothers are corporate, they have to go and work. Yeah, but we hope that our employers can create an environment where these mothers can breastfeed their children exclusively for the first 6 months and then up to even 2 years. Thank you for keeping it here with us. We are still with Dr. Lubega and we are discussing pneumonia. We are going to take a short break. Special mention of our sponsors, National Medical Stores, as well as Camelin Men's Collection for bringing this show to us every week. We will take a break and we'll be back in a minute.
You are watching the DocTalk Show.
It's no secret that ICT makes learning easy.
The strides made in our field couldn't be possible without it.
And now we can watch our favorite shows.
My radio is my best friend.
UCC provides an enabling regulatory environment and policy guidance for healthy competition. We also facilitate ease of doing business in the communications sector through licensing, standardization, spectrum management, tariff regulation, rural communication development, and consumer empowerment. An informed consumer is an empowered consumer. UCC supports local content and innovations. Driving the development of a robust communication sector in Uganda is Uganda Communications Commission.
You are watching the DocTalk Show.
Thank you for keeping it here with us. In studio with me tonight is Dr. Judith Lubega, a pediatrician with Kawempe National Referral Hospital, and she's been helping us understand the nitty-gritties of pneumonia and how we can prevent, and just in case we are attacked, how we can get out of this situation. And as we come to the last segment of our show this evening, Dr. Lubega is going to just give us some highlights, very important.
Yes.
I think in Uganda, I would say akatalekeka, some of those very, highlights for very important. And then also, usually in the last segment, we have what we call to action, use this platform to advocate for the children of Uganda. Yes, Dr. Lubega, take us away.
Yes, just to make another shout out to the issue about breastfeeding.
Okay.
If, like you said, at our workplaces, there is no shame in breastfeeding. Mothers should be proud because you are giving this child a future. It's in your hands. So having workplaces, advocating for places in the work where you could pump this breast milk and also put this breast milk in the fridge.
Wow.
If breast milk can be kept in a fridge for almost even up to 1 week.
Wow.
Any refrigerator that's even that has deeper temperatures can actually even be kept for even a year.
Wow.
The only thing that we'll discuss some other day is that when you get it out, it should only last 8 hours. It should not be used.
So in other words,
yes,
places where maybe there may not be a place for bringing the babies to work, mothers can pump, keep the breast milk, and then when they go back home, they're able to give this breast milk to their babies.
Yes.
Oh, that's good.
That's highly encouraged because it can go a long way in preventing pneumonia. Another thing is self-medication. Parents, please, once you see these danger signs, the delay at home is one of the causes of this mortality from pneumonia. Rush the child to hospital for a specialist's view, and then it's always okay to go back home without anything.
Wow.
But as long as you're sure it's not a pneumonia going on with your child.
Dr. Lubega.
Yes.
Are you telling me that it is normal for me to come to hospital with my baby and then the doctor allows me to go home without medicine?
Exactly.
Oh.
And we do it all the time.
Okay.
And parents will be like, what? I came all this way. But remember, child health, we want to protect your child's health. We don't want to give unnecessary medication.
Wow.
We will count your child's breath rates. We would look at if there's any indrawing, making sure that your child is not wheezing. And then we just let the child back home with you. Wow. And maybe give you different growth monitoring indicators like breastfeed this child, play with this child, and have fun with your child.
Wow.
Yes. And then another thing that I want to talk about is doctor shopping.
Doctor shopping.
It causes anxiety to the parents and even the health giver. Because there are code of conducts. And
what do you mean by doctor shopping before you go into that? What does that mean?
That's a good one. Going from one doctor to another.
And especially in a number of us, some have insurance. So I can put my card in this hospital, I go to that hospital. In a space of a week, I've gone to 4 different hospitals or medical centers.
Exactly. And that's a habit I want to encourage the caretakers. Just don't have a lot of anxiety, because this will also cause a risk of your child being mismanaged, because continuity of care is also key. A doctor who knows your child will also know when it's time to step up or step down the medication. For example, if your child has asthma, the doctor already has a plan for that child. So if you keep jumping from one place, I'm not saying if you feel uncomfortable for any other reason that you shouldn't change, but let it not be anxiety, because this doctor shopping is also hindering wholesome care of your child.
Wow.
Yes. So some of the programs that we can actually think about for the better prevention and control of pneumonia is actually school-based surveillances.
Okay.
Yes. What I know is the Ministry of Health and Education has run some, but we just want to continue encouraging different schools, and I think maybe churches, I don't know.
Okay.
Could have
the number of churches, there are kids that actually every week they are in different churches in big numbers. Yeah.
So having just these surveillance programs of following up the children, these different coughs and these different that are rising up, upper respiratory tract infections. And when we have our thumb on such things, we can know when there is an outbreak amongst children. such as this influenza A, was picked out because of surveillance. And the government of Uganda has the global target of kicking pneumonia out of Uganda by 2023.
Are we for real?
Yes.
That's a target. How are we doing? Are we on our way to that target, hitting the target?
I believe with the pneumococcal vaccine strategy, at first there was some resistance from the community, but I'm realizing that many caretakers are taking on this wonderful initiative by the government under UNEP to embrace the pneumococcal vaccine. And that's what we're really looking towards.
This has been quite an enriching evening of information, of statistics that are quite glaring, but then also hope. That's one thing I've liked about Dr. Lubega. Yeah, the glaring statistics, but then she's also given us hope. This is manageable, something that we are doing together as a community. Yes, I know we're about to come to a close of our show this evening.
Yeah.
Any parting shots to our viewers as we come to a close of this? I know you've talked about the targets by the government, and I know a number of them are watching tonight. There are policy makers that are watching tonight. From your experience as a pediatrician, is there that one thing that you think if this could be done, maybe is there a need for increasing of funding or something that, this could be done, that one particular thing, to the policy makers and then to the general public before we leave?
Yes, thank you so much, Dr. Nyanzi, for that. To the policy makers, I think one thing that is underrated is the continuous health talks actually for the mothers. Especially when we get such waves, is to actually talk on, have radio talk shows and different TV talk shows, and even going to schools and meeting the parents at these different points of care, because actually the anxiety is usually understandable and a lot. So we could also include that on top of the sanitation SOP programs and the immunization extended programs.
Wow.
And then for the community as mothers, I would say, let's breastfeed, let's breastfeed, let's wash our hands, and let's trust the health system.
Wow.
Yeah, we get encouragement from you, and we get more motivated to actually do our best. And we just want you to know that you have a great health system in Uganda. Trust it, and let's work together. Thank you.
Wow. I would love to go on and on and on with this very exciting and encouraging information from Dr. Lubega, but unfortunately, always the clock is against us. But for me, what has come out very, very importantly this evening is the reminder of breastfeeding, exclusive breastfeeding, fathers, uncles, aunties, the community at large, employers. If it is in your capacity to encourage this young mother, some of our mothers probably they're doing it for the fourth time. Even that fourth child needs exclusive breastfeeding for up to 6 months. And then beyond that, we encourage even breastfeeding up to 2 years. That is something that natural, that God has made available, and it has proven to be very powerful against many infections on top of pneumonia. Dr. Lubega has reminded us hygiene, hygiene, hygiene. For the last 2 years, there was perfect, it was part of our normal routine. You have to wash hands before you meet people, but somehow people seem to be relaxing. Even just when they had just opened up, when I was entering into a tax park, you can't enter before washing your hands. Let us get back to washing of our hands before we come around our children and also them washing their hands. Thank you very much, Dr. Lubega. It's been a great honor hosting you this evening, and I believe our viewers have had quite a lot for the evening. As we come to a close, always making mention of our sponsors, that is the National Medical Stores, for bringing this show to us every week, every Thursday, as well as Camelin Men's Collection on Zebra Plaza, that is at Kampala Road, intersection with Entebbe Road. Thank you so much for making this show available to us every Thursday. Kindly remember to share our social media platforms, that is Facebook and YouTube, DocTalk Show. And if you have any questions, leave them in the comment section below and we'll get back to you. Thank you. And as always, your host, Dr. Gavin Nyanzi. May God bless you. See you next Thursday.
The DocTalk Show.